So we're delighted to receive the Prime Minister here at St. George Hospital at the Microbiome Research Centre when he announced a grant of 4 million to our centre, 1 million of which will be dedicated to the MothersBabies Study. So the MothersBabies Study actually is a very interesting story. It started with a chance encounter during a lecture where Catherine Oates-Smith and Alan Liddell were present, and they were asking me about the role of the microbiome in pregnancy. And then together they came up with the idea of having a definitive study that would look at the role of the microbiome in pregnancy. So what is the microbiome? Well, we're inhabited by trillions of microorganisms, bacteria and other microorganisms that live within us and on us, and they have a major impact on our health. And what's becoming clear over the past few years is that this has been the missing link between our genes and our interaction with our environment. We need those microbiota, the microbiome, to actually mediate this interaction between our genes and the environment. So if we intervene before pregnancy and we identify the reason why pregnancy can go wrong, as you can imagine, this will prevent many of the adverse outcomes and will ensure that the next generation of children is healthy. As responsible clinicians, it is our job to ensure that there is the evidence base for our clinical practice. There is a lot of potential in prebiotics and probiotics, and our job is to prove that they are relevant and prevent disease. If pregnant women knew that in fact there are useful probiotics and prebiotics that can prevent disease, I'm sure they'd be very happy to take it, and they would take the advice of the medical profession and the general practitioners based on clinical evidence. So this MothersBabies Study will be the definitive study in this field. It will be the largest ever undertaken, but it will be providing the evidence base and the answers that we're all waiting for. Now, as you can imagine, a study of this magnitude is very expensive. We're delighted, of course, to have received the first million, but we still need another 4 million to be able to accomplish the study to its conclusions. We are very excited to have put together the team that will be able to run this study, and we hope very much to start in early 2019.